My name is Kelly Papish. I'm a nurse practitioner and the clinical director at PMD Alliance. And I just wanted to welcome you all. We appreciate you being here and joining us for the next hour, whether it's your morning or afternoon. It is so wonderful to see so many of you on here. We have a special program today, deep brain stimulation, real people, real experiences. And you're going to hear from a couple people who have had deep brain stimulation and their real life experience. You know, PMD Alliance is really committed to making sure that we get resources, education, training, and opportunities for connection out into the community. And that's what we're doing here today. So we're really grateful for you to join us on this program. And we're thankful for our friends and partners at Medtronic for helping us put this program on today. We have two special guests with us, and that is Fina and Kay, and I'm going to let them introduce themselves. And so, Fina, we'll start with you. Could you please let us know a little bit about who you are? And we're so excited that you're here.
Thank you. I live in Texas, first of all. My name is Fina, Josefina, but Fina is just much easier to remember, like the gasoline stations. Anyway, I live in Texas. I am working. I went into a second career when I was in my 50s. And I work right now as a bilingual interpreter in whatever conferences or courts, mainly in the court system. And I have had Parkinson's now for a while. But anyway, I don't want to take up too much time because we've got a sensational, that Kay is just wonderful. Blue-haired Kay.
Oh,
You both are just wonderful, Fina, and you know, this really is a time to highlight your experience. So we appreciate you being here. And Kay, welcome. Thank you for being here. Please tell us a little bit about yourself.
hi there. I'm Kay Arvidson. I live in Des Moines, Iowa, right in the center of the United States. I was diagnosed in 2017 and I retired in 2018. I worked in the government sector, the private sector, and the nonprofit sector, leading changing the way people worked from manual processes to electronic processes. And a lot of times I worked with e-commerce applications. So that was where I came from. And my Parkinson's journey has been an exceptional one. Do you want me to hear? Can I share about my diagnosis?
Please share
Okay.
with us.
Well, when I first knew there was something wrong with my brain, I thought for sure that my breast cancer had returned and had gone to my brain. And I just buried a friend who had that happen to her last week. So I was sure I was on the path to the end of my life. I was totally unprepared for a diagnosis of Parkinson's disease. And so I didn't know what to do. I remember very little about the appointment except the words progressive degenerative movement disorder and exercise. So that was all I recall from that first appointment. And I went to the library, I got a lot of books, and I became deeply depressed. And then it took me a while to come out of that, like a couple of years, to be honest with you, to get to a positive attitude and a positive spirit. And part of the journey that got me there was my DBS surgery.
Wow, thank you, Kay. I can't wait to get more into that. We want to hear about, you know, the change in how you came to accept this and how you're doing. Um, can I ask you, Kay, what was your initial reaction and like what were about your friends and family when you were first diagnosed?
They were very supportive. My workplace, my friends, my families. We were doing Zoom then because it was just before COVID hit, and my siblings were traveling in Asia, so we had a Zoom call, and I knew they were upset, but I said, hey, if this had been breast cancer in my brain, we'd be having a totally different conversation. And so we adjusted in that respect quite easily to the fact that I had an illness that I was going to have for the rest of my life, but it was not going to take my life.
Yeah, amazing. You're so strong, and I love hearing your story. And Fina, will you tell us about your unique journey to diagnosis with Parkinson's and, you know, how was Parkinson's impacting your quality of life at the time of diagnosis?
When I was diagnosed, funny, life is funny. I met a fella, and we started dating, and this is in 2011. We started dating. Well, it turns out that he's a neurologist. So one day I'm sitting down, and my little finger started twitching, and I had already noticed it before and didn't pay any attention to it. And Steve says, "Are you purposely moving your finger?" And I said, "No." I said, "It just does that every once in a while." And I saw a look, kind of a strange look on his face. And so as time went on, months went by, I would notice that he would just observe me. And I'd forgotten this one thing. I wouldn't, when I walked, one of my arms would not swing. And I thought, well, that's really odd, but I didn't want to ask him because I don't know, not that I was afraid of finding out Parkinson's, but I started suspecting Parkinson's because I couldn't smell anything. And he had a test that he sent in for something. Anyway, this test, it was kind of remember those old scratch and sniffs the kids used to play with? It was that, different things, chocolate, oranges, different things. And he didn't tell me anything about the results. So anyway, eventually he said, I'm afraid that you have Parkinson's. And it wasn't so much of a shock because I think I'd already, I kind of knew that I had it, because anytime that so I was walking towards him, I would notice that he was observing me, but not just a casual look. I mean, it was like he really observed me from top to toe and head to toe. And anyway, but I told my family, I do have Parkinson's, but I told Steve, I said, this isn't going to kill me, Steve. He was really concerned about it, but it was everybody was kind of surprised, kind of, because I'm the strong one in the family, and I'm the firstborn, and stuff like that. But anyway, it did. Everybody immediately, what do you want us to do? Well, nothing. It's just like, and then DBS happened, and boy, that was wonderful.
Yeah, I mean, it sounds like it's a common theme between both of you saying that. And so before we talk about the journey of DBS, Kay, can you tell me, how did you manage your Parkinson's symptoms early on? And did your medications or therapies change over time?
My medications changed. I started off with 4 carbidopa levodopa a day. By the time I had my surgery, I was at 8. I probably progressed in the first year from 4 to 6, and then the second year from 6 to 8 pills a day. And that was my primary medication at that time. I'm on another medication now in addition to carbidopa levodopa. But I managed, at the beginning, your symptoms are not that strong. They're not that, at least they weren't for me. So I was able to manage my movement and my synthetic dopamine very well. And my tremor got worse and worse and worse. And my movement got worse too. And I talked to my doctor about DBS because
So you noticed that there were signs that maybe the medication wasn't as effective, or that your symptoms were getting worse, and that's what prompted that discussion about DBS, or how did that come about?
yeah, my symptoms were getting worse. We had a Zoom meeting, which was the first time I've ever had a Zoom meeting. And so I was walking around. She asked me to walk around and do the flipping of the hands and the touching of the fingers and things like that. And I said, well, how am I doing? And she said, I think you're a candidate for DBS. And I said, I'm delighted to know that. Let's get going on the process. When can we do this? She said, let's start now. So we did. And there were a few things that were involved with it. I had to do some tests and like an on-off thing where I went in without any medication in the morning and did some things that she was assessing, like the fingers and the hands and the walking. And then I took the medicine and came back an hour later and did it again. And she assessed the difference between those 2 appointments. And that was okay for DBS. It depends on how you respond to your carbidopa levodopa. You respond well, you can be a good candidate.
Yeah, wonderful. Thank you for sharing that. It sounds like, you really you also were advocating for yourself, being informed on what DBS was and doing some of your own research. Fina, can you tell us a little bit about what your symptoms were like early on outside of that pinky moving? Did you go on medication right away? What was that like, and how did that change over time?
Yes, I did go on medication right away, and my grandson tells me that I'm a medicine weenie because I don't do well with medicine. I tried probably every single medication there was, and it seemed that the carbidopa levodopa worked the best. But I tried I just so many medications, and I as Kay progressed medically. I mean, medicine wise. I remember my symptoms. I had dystonia, and I would tell my sister, sit on my feet because they would just twist. And it was a little painful because of the pain, my legs. Anyway, so it got to where I was taking the carbidopa levodopa quite frequently. And when Steve told me, there is a surgery, and he referred me to someone locally, and that was just wonderful. But the medication really wasn't doing very much. I think I was every 2 hours I was taking a pill. Every 2 hours, not around the clock, but I would stay up to take my night pill. I would stay up as late as possible because I wanted to get a good night's sleep, which hadn't happened in a while because I mean my legs just, it seemed like they just wouldn't stop, just with not so much wiggling, but just twisting. And 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 then when I was aware of the deep brain stimulation, which, let me just make a brief parenthesis, not very many doctors are aware that this exists. And I think it more and more that I've talked to people, they became aware of, on their own. But I remember going to my general doctor and afterwards, and I said, "Oh, I had the deep brain stimulation." She said, "Well, what is that?" And I thought, my goodness, and that wasn't the first that I'd heard about that. But anyway, I like to whenever I can talk about the deep brain. But it got to where my sister would sit on my legs, and we would just start kidding and razzing and just joking and just having fun with it. But man, it was just painful. I think she was just trying to get my mind off of it. But then shortly after, when I found out,
Thank- that sounds like a nice song. I got sunshine, bringing some positivity. Um, Thea, thank you for sharing that. I know it's difficult to talk about some of this, and you're not alone, right? You two here have gone through similar experiences, though very, very personal to you. And many people maybe on this call know a loved one or are going through something like this similarly. And being able to share this, it's a wonderful thing to be able to show how you've overcome it, and how perhaps the therapy could help bring about better quality of life. And so thank you for that. And so can I ask you guys, deciding to do DBS? So Fina, when this was first brought up to you, because your symptoms were getting so severe that medication wasn't really making the right benefit that you needed, or you were taking them every 2 hours, waking up overnight. When you really considered DBS, what what were your initial thoughts or questions about it?
well, there was no question in my mind I was going to do it. No question. As soon as I found out, I immediately called the doctor, set up an appointment, and got it going. And I started, of course, researching, and I thought, man, this is it. This is for me, because at that point, your life is, it really, it just puts a damper on everything. You don't want to go out. and eat because, you're just a spectacle sometimes. And I do remember that I had to quit working because my job is in a courtroom, and I'm sitting there and I'm interpreting, and I noticed that some of the people were not even paying attention to the what was going on in the courtroom because they were staring at me, because I'm a wiggling mess from head to toe, and I would have to take my pills very discreetly while I was there because it just that's courtroom life. Sometimes you're there all day long. But anyway, it it was a blessing. As soon as I found out and I started doing the research, this is it. And I told the doctor, no question about it, let's just schedule it. And so it was out a few months, but he said, okay, there were about 3 days later, his secretary called, there was a cancellation. And I told him, if there's a cancellation, move me up because I want that. I want to be, free of the wiggles. I used to call them the wiggles. But anyway, then there was an opening and I went in and then game changer.
Wow. Okay, it sounds like from Thena's experience, she had no question. She did her own research and she was like, sign me up. It sounds like
Mhm.
you were pretty interested right away too. Was there anything that helped you make an informed decision? Did you talk to other people who have gone through DBS? Did you do your own research? Did you just talk to your provider? How did you make that decision?
Well, I attend every year. The American Parkinson Disease Association has a conference in June for people with Parkinson's disease. It's the largest conference in the nation. And the first time I went to this conference, I walked into the vendor area and the first table was Medtronics. And I met my Medtronics representatives at that time. And I started asking them about this process. And I was just sold on it, hook, line, and sinker. I wanted it. And I was distressed because I was newly diagnosed. I had to wait 4 years before I was able to do it. But I understand that that's important because you need to be stable with your medication. And there are other factors that come to play that make waiting a little bit important to do. So I knew right away that's what I wanted to do. I did over the course of the next 3 years talk to people who'd had it and found out about good stories and bad stories and how people resolved both of those issues. And I had no doubt in my mind this is what I wanted to do, and I did it. And I had a lot of fun telling people I was going to have brain surgery. You can play that card a lot of times in a lot of different ways.
Did your provider, I guess, recommend Medtronic, or was it really the rep that you met out at a conference that brought you back to your provider to say, I'm interested in the Medtronic system? Was there a reason why you chose that system?
My neurosurgeon chose that system, and I didn't know there was anybody else out there. I just thought it was all Medtronics, but I'm really delighted that I chose Medtronics because it's a very powerful, the battery, the brains of the thing, which is a device that fits under my right clavicle, so that if I ever need a pacemaker, I have my left clavicle open. But anyway, it's a very powerful piece of technology, and I am participating in research right now at the Cleveland Clinic, looking for other things that it can be programmed to impact, other symptoms that it could impact. So I'm really delighted that I have this advanced technology and the ability to help others understand and not be afraid of it. And I think not being afraid of it is huge because it's so beneficial, and it's a scary thing to think about brain surgery, but it was nominal. It really was, and it was easy to do. And my recovery was smooth. I was driving in 3 weeks. I mean, it was just really, it was, in many respects, a piece of cake.
That's
And it
amazing.
gave me such great results.
Well, I want to hear about your experience with all of that. Thina, I wanted to ask you, how did you hear about the Medtronic system? Were you informed about multiple different systems? How did you choose Medtronic? Was that what you researched, and how did that come about?
Just like Kay, my neurosurgeon was familiar with Medtronics, and there was just no question about it. And funny that Kay, I'm glad that you mentioned which clavicle, because that's one thing. If anyone is considering DBS surgery, there's a few things that I want to mention. I don't know if I'll take too much time, but I'll be quick. first of all, take a hat or something, because the surgery, it involves maybe not just one, two, possibly even three surgeries, and each time they shave your head. And if it's in the winter time, I mean, your head's going to freeze. So take a hat, and don't take a turtleneck, something you're going to have to pull over your head, and decide which side the implant, because if you drive a lot, make sure that be careful with that, because it will rub right up on the neurotransmitter. And so that I took that into consideration. I got all these pointers from a very, very good book. It's called Life with a Battery Operated Brain. And the author is Jackie Christensen Hunt. Again, the book is Life with a Battery Operated Brain by Jackie Christensen Hunt. She had the surgery as well, and that was many years ago. Anyway, but when I went into surgery, you're semi-awake. Well, the doctor, my neurosurgeon, said it was kind of amazing, because he said, "What kind of music do you like?" And I said, "Well, I like dinosaur rock, the old rock and roll." And he said, "Well, okay." So I don't remember this, but American Pie started playing by Don McLean. In the last verse, it says, "This'll be the day that I die." And I said, "This'll be the day that I won't die." And he said that was amazing, that, you comprehended enough, and you knew that verse was coming up. So I immediately said, "I'm not going to die this day." And that was kind of amazing. And that's something I wanted to share with everybody. But if you're considering it, do, because quality of life before DBS is quite different. There just about is no quality of life. I mean, like I was saying before, you don't go out, you can't eat in public because you're afraid, you're going to be, spoon's going to be going all over the place. And after the surgery, I mean, it's just wonderful. Really, really great. But that book, I do recommend that book. It gives a lot of pointers of what to do before surgery, and just great pointers.
Thank you, Fina. And we did put the link to the book in the chat. And so that's a really, you gave a lot of awesome tips. And I think that's really helpful to hear real life experiences. Like, I wouldn't even think about the seatbelt and which direction that goes and how that affects when you're driving. And Kay, I would love for you to tell us a little bit about the actual, I know you said you were, back to doing things within 3 weeks, but tell us, what was the actual surgery like? And can you tell us that? Yeah, how was
Sure.
recovery?
I made a game out of it. I wanted to remember the names of all of the people that I met. And I met a lot of people. I must have met 24 people between the people who were doing the prep work and the neurosurgeon and the assistants to the neurosurgeon, and there were a lot of people there, the nurses. So I worked on remembering everybody's name, which kept me occupied. And also, I did not have all of my head shaved. I just had some parts of it shaved, here and there and there. And so when you first go in, the first surgery I had is the one that goes into your brain, and they use a sonar to identify exactly the location that they need to go to. And the Medtronic's representative was there in the hospital with me. I was delighted to see that. And that impressed me as well. So that was about a 4.5-hour surgery. I was semi-conscious, like Fina said. And they asked me questions and I answered them about, I had to move my hand like I was turning a doorknob and like I was shaking hands and things like that. And then the second surgery was the one that, well, the electrodes were wrapped up and under the skin of my scalp after they went into my brain. And then the second surgery put the battery in, and I was unconscious for that. I was out for that. So then they hooked up the battery and took the leads down behind my ear and down my right side to the battery. And that I was not as prepared for that surgery. I focused more on the brain part and not on the battery part. So I was not as prepared for the second one. It was a little harder than I expected, but it was not a problem. I got home okay, um, and I rested a lot. I stayed with some friends after the first surgery. He was a doctor and she was a dear friend of mine. I just wanted to be around people who would know what to do if anything happened. And nothing happened. I didn't talk funny. I didn't drool. I didn't have trouble walking. I didn't have trouble with any aspect of daily life, which I was very pleased about. I didn't know what would happen after surgery. I just wanted to be sure.
Yeah, I mean, and I think that's, you're taking all the right steps so that you felt the most comfortable. Thank you for sharing that and for sharing the different steps that you had. What about you, Fina? Will you briefly describe your experience with the actual surgery and then tell us about your first programming session?
The surgeries, everything was fine. Like I said, another thing that I failed to mention is take a little pillow or something if you're going to do the surgery and put it over the incision, because the neurotransmitters, like the size of a Zippo lighter, the old-fashioned ones, and it does, with when it just happened, the incision is there. So just put a little pillow over your incision when you put your seatbelt on, and that'll, for whatever reason, it just really helps. And I'm just, the fact that you're holding something warm, I don't know, just does something. But anyway, after the surgery, mine were 3 surgeries, and one was a little tougher than the rest of them. And I say tougher because you still have you're not connected yet. And so, having surgery, and that both my sisters, they flew in, and they were helping me. They were spoon feeding me. The last surgery was a tough one. That's when they came in, and it was a little tough, not too much, but anyway. Then came the day that everything was going to be turned on, and I was, went over there, and I'm ready, and I'm sitting there, and I'm a wiggling mess still, and then the system was turned on. What it is the neurotransmitter they give you what is like a cell phone and a little mouse. In that one, the programmers they program the little transmitter. So that transmitter talks to your receiver that is in your chest on the side. And when she turned it on, are you ready? And so my hands are, going up and down, and my feet are wiggling and whatever. And then she turned it on, and all of a sudden it was calmness. She says, okay, walk. I got up and I walked. I wasn't, afraid of shade, nothing. I walked just fine, and tears just, everybody's crying. It was just happy occasion. But it was, man, what a changer. If you really seriously, if you're considering it, please don't think twice about it. It's such a life-changing surgery. I just cannot tell you. Your life will just almost go back. I say almost go back to normal, because you have to be careful, because what was told to me by the Medtronic's representative here, your skin, you have your implants, and all you have covering those is your skin, your scalp. So you can't use any wire brushes or anything like that. You have to really be careful protecting your head. As a matter of fact, I took a fall the other day just because I was being careless. And I remembered as I was falling to turn my head, because I thought, if I just fall back, that's it. I might have to go back to surgery. So I just purposely fell on my arm. I just turned sideways, and thank God, because otherwise I shuddered to think what could have happened. But anyway, you do have to be a little bit careful afterwards, with protecting your head like everything else. But after I had the surgery, another tip, you cannot take your medication like you used to, because I thought, oh, I'm just going to have to keep on taking medication. So I left. I was thrilled. They turned the system on. I wasn't shaking anymore. Go out from the clinic and get in the car. And then my sister were, practically jumping up with joy. And they wanted to go get stuff and get something to eat. So we did that. And then I had already taken my pill when I left the clinic. Well, it's just too much. So I'm sitting in the car waiting for my sisters, and all of a sudden the wiggles just kick in. And I'm frantic. I mean, my arms are just flailing wildly. And I'm thinking, okay, I need to disconnect this thing. Something's happening. And I grab it and I start whacking my own head with it. And then my sisters see me and they say, "What's going on?" I said, "I don't know. I don't know what's going on." So one of them gets in the back seat and she's pulling on my sweater. And anyway, that passed. I said, "What in the world?" So I called, immediately, and I'm talking to the rep, and she said, "Well, you anyway." Turns out that she mentioned it, but I never caught it. Anyway, I am now on 1/4 of a pill once a day. That's it. I do not take any other medications. Sometimes it's a little bit different. Someone might have to take a little bit more, a little bit less, but I do not shake at all, at all. I don't twitch, anything at all.
That's amazing, Fina. Thank you for sharing that. And, you got emotional talking about when it first turned on. And I've been the clinician programming somebody for their first session, and I've shed many tears of joy with people going through that experience. It never gets old to see, what can happen to tremor or dyskinesia, just settling down some of those movements and improving that quality of life. Thank you for sharing that. Very special. And to hear about, how things kind of are also were impacted, like your reduction in medication. And can you give me do you have a word or a phrase that you could use to describe what it felt like to turn on the system? What did the stimulation feel like? Was it scary? Was it a rush? How did it feel?
Like everything was normal again.
Hmm.
I wasn't shaking. I wasn't anything. It just all of a sudden, I mean, I was sitting on the chair when it was turned on, and what a relief that it just a relief. That's the only one word that I can say, because what a relief to be back to normal again, to not be afraid of going anywhere, just be able to do things that were normal before. Not that I became a recluse, but I just didn't want to go out to eat anymore, because, I mean, you don't know what the fork, it's going everywhere. You're trying to stab your salad, whatever. And it's just, you just think, I'm going out to just embarrass everybody. So, "Oh, don't worry about it. Let's just go." And, we would go. And of course, my family, you fall, they laugh. And there's just no mercy, which is great because I didn't need any mercy. They want, but anyway, it was just such
Yeah.
a relief to be
That's an
back.
amazing way to say it. It was a relief. Like you said, I felt like myself again, I felt normal again. Kay, I want to hear from you and your experience. What did it feel like to have the stimulation turned on for the first time? And I think if you're okay with this, Kay, we have a special video that you submitted. Can I show what it looks like you might have felt like? And then can you describe it for us after we show it? I have a
Sure.
wonderful video that
Um,
Kay submitted to us, and we want to play this for you guys. And you can see in this video her tremor pretty severe. There's not sound to this. There was music, but and once she pushes on her programmer, the stimulation, you can see the still hand.
you can also see my blue hair.
In her blue hair. We'll do it one more time. It's short enough. But what I wanted to point out was there's, when you get this programmer that's down in front of her, that phone, that is something that you have some control over. and you can hear her, you can see her mouth. It's a miracle. So thank you for sharing that video with us.
Sure.
We want to hear from you. Okay, tell us about what that felt like to turn the stimulation on that first time.
Well, the first time I was asked if I wanted to address the tremor or the movement disorders that I was having. And I said the movement disorder because it was really bothering me. And then when I went back the second time, I said, no, I got to do something about this tremor. This tremor is driving me crazy. So that's when we did the tremor. That's when we did the stimulation that had the most effect. And I stopped shaking immediately. I mean, it was just amazing to me. I got up, I walked around. It was just astounding. It was like Tina said, you're back to normal. It was incredible. I just can't even describe it, except that I was just so greatly happy that I had the courage to go forward with this surgery, and I had the great results that I had. I dyed my hair blue as soon as I had the stitches out because I thought, why not? When else am I going to dye my hair blue? This was we were just coming out of COVID. It was 3 years ago. This time I had it on my birthday, which is today. I had my surgery on my birthday 3 years ago, and so it was a lot of. It was wonderful. It was really wonderful to do the blue hair, and everybody was looking at it, and it was kind of crazy. But when else am I going to dye my hair blue? After brain surgery, of course. And so I had fun with that. And the turning it on was just, it was a miracle. It really was a miracle.
Well, happy birthday. And
Thank you.
Happy birthday.
what a beautiful story. I mean, both of you, this is just so incredible to hear your journeys. I'm interested now, at the point that you're at now, remind us how far out you are from DBS and what is your ongoing experience to like optimize your stimulation, optimize your symptoms right now? Has your medication changed? I think it has, I heard from both of you, but how? And what is your ongoing experience with programming the DBS? Fina, why don't you start?
I really don't have adjustments. I have met with my Medtronic representative probably about my surgery was in October of 22. And I kid with everybody because right the day before Halloween is when my last surgery happened. And I was ready for Halloween. I think if I would have gone anywhere, I'd have gotten the prize because you could see, that you end up with stitches. It not just in one particular place, but you have about three different, places or four where you have stitches. And so, um, but I just after that, I went to a quarter. So my Medtronic representative, she really doesn't. I mean, it's adjustment, but it's just a few little adjustments that she makes because the way that she explained it, you have to be in between, a certain range, and then if you're not, I think that those are the adjustments that she makes. But I mean, I don't shake. I don't have hardly any adjustments when we've gotten together for the adjustments, and she
That's
says you're
amazing.
doing, and that's good because adjustments, I don't know the intensity or I don't know what it is, but that will work off it works off of the battery, and the battery eventually you'll have to have it changed, perhaps every 5 or 7, 6, 7 years. I don't know if use it up a lot. I guess you have it won't last as long, but and when you do go, it's just the battery that they will change, period. So it's not nothing to do with your head, it's just the implant that you have. So it's
Thank
very
you.
simple.
Yes. That's a good thing to mention, that there are some things that you think about, and there's priorities within your symptoms that you're trying to manage. And you mentioned when you're feeling pretty good, you don't need to make a lot of those adjustments. It's a win all the way around. And Kay, you mentioned that too, that you kind of picked, like, was it tremor or was it stiffness or rigidity, or what were you trying to really manage with some of the stimulation right away? Um, can you tell me about your current the current appointments with programming and what impact, like, overall has this had on your quality of life?
I see my neurologist every 3 months. I get an injection of Botox in my cheeks because I have a quivering chin that has emerged since the surgery. And so that's my major tell. So I do see her every 3 months, and we do a minor adjustment on the stimulator every time I see her. And so that's keeps me in check. We've increased my medication. I'm on something called GoCovery, which is a very expensive med, but I'm on GoCovery at night, and then I am on carbidopa during the day. And it's addressing the left-hand side, the right-hand side of my brain, which addresses the left-hand side of my body. And so that's helping with that tremor. I did not want to turn the stimulator on too much because my left hand tremor was sporadic. It was not continual. So I wanted to see if we could manage it with medication until it got to the point where we really needed to manage it with the stimulator. So that was going really well there. Oops. Sorry, I'll turn my phone off. There we go. So that went really well. And I'm sorry, Kelsey, I forgot the second part of your question.
Oh, I just wanted to know, like, overall, what would you say is like the impact on your quality of life?
Oh, it's been phenomenal. It really has been phenomenal. I decided, I found a quote that I have used to guide my life after my DBS surgery. And that quote is that the purpose of life is to find your gift. The meaning of life is to give it away. And I decided to give my gift away to Parkinson's disease. So I joined the board of the American Parkinson Disease Association here in Iowa. I resurrected a magazine that had been published. It had not been published for 2.5 years. It had been dead over COVID. We brought it back with information for 4,000 people in the state of Iowa with Parkinson's disease. We produce that 3 times a year. I am a mentor for twitchywomen.com. I am part of the Michael J. Fox Buddy Network. And I just really, I do research. I volunteered to do research. I'm doing participating in research at Iowa State University and at the Cleveland Clinic, because there's so much going on right now to try and understand and impact what's going on with Parkinson's disease. Plus, by 2030, more people will be over the age of 65 than under the age of 65 in this country, which, as the baby boomers age, is something we haven't seen yet in our history. And that's prime age for identifying Parkinson's symptoms. I live in an agricultural state. There's a lot of ties between pesticides and Parkinson's disease. And I have seen projections that the number of people with Parkinson's will double within 10 years. So we call it the gray tsunami here. It's coming. And so I want to do everything I can to impact the best way I can this illness.
And you're doing amazing. You're an advocate in so many ways. You and Fina being here, Kay, thank you both. Like, this is sharing your story. You're doing your part in helping our community, and it's really amazing to see. I do want to make sure that we give you guys time to leave us with some pearls. But we have had a lot of questions that came in, and so we're going to start with some of those questions. And so one of the things that I wanted to ask you both, the question that was asked is, how many extra hours of on time do you experience compared to prior to DBS? And what symptoms have helped you with that? So what symptoms did the DBS mostly help? And how much more on time do you feel like you have? Fina, how about you?
Well, I don't have any downtime at all. I don't have a tremor. I don't have dystonia. I don't have anything. I haven't developed anything. My surgery was in October 22. So we're going on 2 years that I have had the surgery, that I had the surgery, and I don't twitch. I don't have nothing. So my life is, when I said that it's a miracle. I've gone back to normality, 100%.
Yeah, that's amazing. How about you, Kay? Do you want to speak to on versus off time pre-post DBS, and maybe what symptoms you mostly felt improvement with?
Sure. Like Fina, I have no downtime at all. I feel like I am always on. And that's a wonderful feeling. It's like being normal again. Now, I have had some more movement issues as things have progressed. And so I'm experiencing that right now. And so I am using a cane when I need to, but that is taken care of. And when I fly, I always get a wheelchair because you get right up front and you get from the gate to the counter and counter to the gate, and from the gate to the baggage claim, and it's easy as pie. So if you're traveling, be sure and order a wheelchair. It's the best tip you could ever give anybody. And so that's gone really well for me too.
Amazing. Somebody asked or mentioned my DBS left me with a very lumpy top of the head. So they felt like they had some, where the incisions were, where the burr holes were, where they went in, that they felt like they had a lumpy, head. And did you experience that? What was your experience?
I have lumps on my head, but with curly hair, you don't see it, and I don't feel it. So I can tell that there's a lump over here, there's a lump over here, but it's minor, and in the scheme of things, who cares? I'm happy. I don't shake. That's the thing that matters.
How about you, Fina?
Lumpy is the least of the problems, but yes, I've got dips. I don't have lumps. I don't have bumps, but I've got dips. I've got
Okay.
about dips. The scars, I'm sure that they went away, and I was really concerned about my hair growing, and it's grown just fine. And if you can see a scar every once in a while, that's a war wound. And I'm glad to talk to whoever wants to listen, because I strongly do encourage anybody who has Parkinson's. You were talking about the wheelchair. The airlines, when I was so wiggly all the time, my son had at one time requested a wheelchair, and they write it down, the airlines, that you that you request a wheelchair. So now, if I ever travel, which I like to do, it just says there. So when you get there, oh, and your wheelchair, just wait here. We'll bring your wheelchair up. And you're right, Kay. That's a really good tip. But I've never canceled it, because now I really don't need a wheelchair. Maybe just for speed. I'm not going to presume that I can run. I haven't tried it. I'm 71 years old. I don't run anymore. I just walk very carefully, because I don't want to bump my head and get another lump or bump or whatever. But yeah, you end up with little dips in your head.
Mhm. Yeah, it's like a give and take, I think, for some people, right? You look at what you're saying, and that's the least of your worries. Some people may be affected by that more with the aesthetic look. Um, how about somebody asked, I don't know if you're comfortable sharing, maybe even just the region that you're in, but they were asking where you had the surgery done. Do you guys are you comfortable sharing what city or what state you're in?
Sure, my surgery was done at the University of Iowa, in Iowa City, Iowa, and my surgeon was Dr. Jeremy Greenlee.
Thank you.
I live in El Paso, Texas, and my surgery was done by gosh, I have a senior moment now. It'll come to me.
Okay.
Anyway, it was done at Sierra Medical Center.
Okay, great. Thank you both. There's a couple questions that came in. Someone asked about what effect does DBS have on speech and cognition. There is a thorough candidacy workup, and that includes, like Kay mentioned, this on-off testing. Historically, we like to see about a 30% improvement in on-off testing, meaning that you get tested in an off state, doing all of your motions, you take medication, retested, we want to see at least a 30% improvement. That tells us that if the levodopa is working, the stimulation is very likely going to have a similar effect and be beneficial. There's also neuropsych testing that is completed. And what the cognitive testing does is really allows for us to understand a baseline. You could have some mild cognitive impairment and still get implanted with the DBS, but we want to make sure there's not severe underlying neuropsychiatric or severe cognitive decline, because there is a potential, any brain surgery, that there could be worsening cognition. they're so fine-tuned at putting these leads in now that speech, unless it's in the wrong place, really isn't always, it's not something we have to worry about often, but it can be affected. And when they place the leads in, they do different testing. When we turn on the stimulation as a clinician, we're testing as well. And if there's any type of worsening of speech, sometimes it's stimulation related, which means we can stay away and steer away from that part of the lead that's in the brain, and we can go to a different area to get a similar effect to reduce symptoms, but stay clear of some of those side effects like speech. Someone said, I'm concerned about how long it lasts. Can you remove it? Can you redo the surgery? How do you know if it's time to replace it? The DBS system can stay in indefinitely. The battery, as Fina mentioned, may need to be changed, and that just depends on which system you have, whether you have a rechargeable or a non-rechargeable battery. They can last anywhere between 3 to 5 to up to 10 to 15 years if it's rechargeable. Unless something like, I don't know, something took place to cause you to redo the actual surgery, or if it was implanted incorrectly. Again, if you're going to a reputable surgeon, that's unlikely to happen, but anything's possible where you may need to get that reimplanted. Otherwise, it's really just the battery replacements. We don't look at redoing the actual lead placement in the brain as often. It can be removed, and that is something that's nice. You can have the system taken out if needed. Somebody mentioned they went through the pre-DBS testing. They were told they weren't a good candidate because they had high expectations. The doctors were mentioning that perhaps stress could exacerbate some of the symptoms. And so they are going to be observing and following for potential DBS in the future. It's tough. Expectations have to be managed from day one, right? Like you said, you're not going to go out and go running and just get this turned on and go run a marathon if you weren't already doing something similar. But what it does is the good on time that you feel with your medication, that's what we're trying and hoping to achieve with this stimulation, that good on time. So that would be more of a realistic expectation. What do you feel when you're optimized on your medication? That's our goal. That's what we're trying to get to with stimulation. Sometimes there are other components and factors during that neuropsychological testing that maybe make you not a great candidate at the time. And that can vary whether it's related to managing expectations or if there's any neuropsychiatric or cognitive components that they're concerned about. So I would really just follow up with your provider on that. Some things do change though too, so if they're following you and you weren't initially a candidate, perhaps you would be down the road. Let's see, and then I think I'm getting all the questions here. Somebody asked, are either of you involved in the faith component of your recovery? So I guess, what did you do for support with your recovery, both Kay and Fina? How did you attend support groups? Did you find other people to help?
I go to support groups. We have a focus group, well, not a focus group, but a support group here in central Iowa, and I found that extremely beneficial. I also had the support group with my exercise, and that was the first support group I had, and that was wonderful. It's just a biking class, stationary bikes, and a group of people with Parkinson's, and we've stayed connected ever since I walked in that door.
Amazing. That's wonderful. And Fina, briefly, we only have a minute left, but can you just briefly tell us, are you involved in anything for support post DBS?
Not an organized support. I have lots of friends, and they would come over to the house when I was with my shaven head. They would come over to the house and they would bring things, and we're going to come over and visit you. And it was just wonderful. Surround yourself with family, with friends. Be positive about things. And I do remember my doctor's name now, Han Bali. Dr. Han, great guy.
Wonderful.
Great.
There's so many comments and awesome engagement discussion. I wish we had more time. I just wanted to address, somebody asked if you can do radiology tests such as x-rays and scans after DBS, and you can, and actually now many of them are they're MRI compatible. So that's something that you could talk to your provider about to be sure. But most of the time, all of those imaging can be completed post DBS. Please use this page, get the QR code, reach out to the number or the website that's listed there if you have further questions. We could probably sit and talk to Kay and Fina for 2 more hours because you guys are so great at sharing your story, and it's just so wonderful to hear everything that you've gone through and now where you're at. It's such a gift for you to be able to share it with us. We're grateful to Medtronic for getting us all together today and for introducing us to the two of you. And Fina and Kay, thank you so much. Do you have one last I guess item or a pearl that you want to leave with the group? Kay.
My mother had neurosurgery for a familial tremor, or another kind of tremor, not a Parkinson's tremor. And she had a halo and told me it was a horrible experience. And I've got to tell you that the halo was not nearly as bad as I was afraid it would be. And it was not difficult at all. You want your head to be stable when they're going to do brain surgery anyway. I just needed something under my neck so that I could relax because I'm used to feeling a pillow under my neck. And once that was there, everything was just fine. It's not to be afraid of.
Thank you for sharing your experience. And Fina, any last words of wisdom?
To support Kay's her motto in life. Sam Walton's wife, Helen Walton, said one of her things, it's not what you gather in life, but what you scatter in life. And I want to scatter that. Go for it. Just don't hold back because it's a game changer.
You guys are amazing. Thank you. I am so happy to be able to meet you, work with you, and to be part of this today. So thank you. Thanks for everyone for joining. We'll give our little wave of gratitude to Fina and Kate today, and we thank you all.
Kelly.
Thank you, Medtronic, for helping partner with us. Thanks, you guys.
Thank you,
Thank
thank
you,
you everyone.
Medtronic.